my name is Paola Mendoza, and I will do IVPB for my class Nurs 130. So before I enter into the patient's room, I already did my first and second check on the MAR, where I check the patient medication. And he has an order for cefaxolline, 2,000 milligram and 100 ml. I will perform hand hygiene before entering into the room. And I will introduce myself. Hello, my name is Paola, and I will be your nurse. Could you please confirm your name and date of birth? Okay, and checking with the bracelet. Okay, and could you tell me if you have any allergies to any medication? I already did my pre-assessment where I check labs, BUN, creatinine, and in this case, you have antibiotic medication for your stomach infection, your diet infection. So I check the signs of infections like fever, chills, and discomfort. Now I'm gonna proceed to check the IV side. Putting on gloves, performing hand hygiene. Even if it's running and I have normal saline, I also, because it's IV piggyback, I would check for compatibility between the primary and the antibiotic. It's compatible cefaxolline with normal saline. And I'm checking for any infiltrations or pain in the area. He doesn't have it. Okay. And then I will pause. Open my secondary tubing. I will hang out this. And I will do again after check with my MAR that I have cefaxolline 200 milligrams in 100 ml. It's not expired and it looks good. I'm gonna open and spike. Okay. And make sure I clamp. Fill up my chamber and prime. Okay. And then I'm gonna clean the port where I'm gonna touch my IVP back for 15 seconds. Here I don't need to wear gloves because I'm not touching the patient. Okay, now I'm gonna proceed to program. Select channel, secondary, cefaxolline. I have 2 grams, that is 2,000 milligrams in 100. The dose is correct. And I just need to make sure that the rate after my rate calculation, it has to be 100 ml per hour. So now it's correct. I'm gonna start it. Make sure I have the first drop and explain that part of the adverse effect of the symptoms can be urticaria or diarrhea or vomiting. If the patient presents any of those, you can let me know. And I also checking that it's not any discomfort. Well, I'm also labeling the tubing that is good for 96 hours. I see that is the drip, and I will label with my initials and time that I started. And then I will proceed to document.